The government should not hesitate to enforce a 2-week hard lockdown immediately. The OCTA Research team pushes for such lockdown to cut the transmission of Delta COVID-19 variant, saying the best strategy is to implement the go early, go hard strategy.
What we're envisioning is really something along MECQ, ECQ. But it will depend on government, and it's the amount of precaution we need. No, it was a precautionary recommendation because of an impending, a clear and present danger posed by Delta.
Once a hard lockdown is implemented, cases in National Capital Region will be prevented from doubling in 2 weeks. Daily cases in the NCR could rise to over 1 to 2,000 daily. Currently, the reproduction number in the NCR is 1.33. OCTA Research Fellow Professor Guido David says this is almost the same when the country had a case surge during the first week of 2021.
It looks like it's manageable at this time, but it may no longer be manageable if we wait too long before we make crucial decisions in our pandemic management. We're averaging 1,000 cases. 2 weeks ago, it was just around 600, and we thought it was decreasing. But now something is driving the pandemic, pushing the caseload higher.
The worst case scenario is the hospital capacity could reach the critical level up to 100% in the NCR by August if Delta continues to spread. OCTA Research Fellow Professor Ranjit Rai explains that although a lockdown is implemented, COVID-19 vaccination should continue. Also, the interval time of COVID-19 vaccines like Sinovac and AstraZeneca should be shortened in order to fully vaccinate Filipinos and protect them from the virus.
Ramp up vaccination even while we're on lockdown. And I think we can still do it. OCTA is exhorting government to focus on its plan. We believe its plan will work, which is the NCR plus 10. I was told by Secretary Galvez that maybe sometime in August, 2 million Moderna vaccine is coming as donation through COVAX of the United States.
Presidential Advisor for Entrepreneurship Secretary Joey Concepcion agrees with OCTA's proposal, saying the country's economy could still survive if an early lockdown is implemented.
If the government, the DOH Secretary Duque will push for a 2-week hard lockdown, we will support it because we prefer that we solve the problem early and not wait for the problem to get bigger. Then we will have to lock down for months. That is the most catastrophic thing that could happen in our country if that happens in the fourth quarter.
President Duterte in his last honor said the country can no longer afford another lockdown, but with the threat of the Delta variant, he will not hesitate to impose another lockdown if needed. People are advised to be more responsible, be not complacent, and have their COVID-19 shots as ways to avoid getting infected with the more transmissible and deadlier COVID-19 variants of concern like Delta. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.